Did you know that more than 80% of baking soda users are unaware of its most powerful health secrets? That's right. Millions of households are using this simple white powder to bake cakes or freshen refrigerators, while missing out on its potential to change lives. Many experts quietly call it the world's most underappreciated medicine. But why don't we hear more about it? Think about it. When was the last time you considered baking soda as anything more than a kitchen ingredient? What if I told you this cheap, everyday powder, which costs just pennies per use, may help support your kidneys, immune system, joints, skin, and digestion? Throughout this video, we're going to uncover its most surprising health benefits, many of which are backed by science but hardly anyone talks about. We'll also go over critical safety warnings, because while baking soda can heal, it can also harm if misused. And I promise you'll never look at this humble white powder the same way again. If you're concerned about your health and want natural, low-cost ways to take control, you're in the right place. Oh, and before we dive in, don't forget to like this video, subscribe, and tell us in the comments where you're watching from. Let's build a global community of smart, informed, health-conscious people just like you. Now, are you ready to explore the incredible healing power of baking soda? Let's begin. When people think of baking soda, they usually imagine something for baking or cleaning, but few realize its powerful effect on the body's internal detox system. When dissolved in water, baking soda becomes alkaline, helping to neutralize acids both inside and outside the body. This makes it useful not only for skin irritation, but also for supporting detox from within. One of the most popular uses is the baking soda bath. Soaking in warm water mixed with baking soda may soothe itchy or inflamed skin and help draw out impurities. People report smoother skin, less irritation, and an overall feeling of balance after just a few sessions. It's like a reset button for your skin. But the real magic happens inside. Some holistic health advocates believe that drinking small amounts of baking soda may support the body's ability to flush out toxins and maintain pH balance. Here's where it gets interesting. Studies show that baking soda may benefit people with chronic kidney disease, helping reduce acid buildup in the blood, known as metabolic acidosis. One landmark study in the Journal of the American Society of Nephrology found that taking sodium bicarbonate supplements helps slow the progression of kidney damage in patients with CKD. This doesn't mean everyone should start drinking baking soda water daily, far from it. Your body already works hard to maintain pH balance, and overuse can be harmful. But when used in moderation, under guidance, baking soda may offer a gentle, affordable way to support your body's natural cleansing process. The key takeaway? You don't need expensive detox products or extreme diets. Sometimes nature's simplest solutions are sitting in your kitchen, quietly waiting to be understood. There's a reason so many natural toothpastes and home remedies contain baking soda. It's one of the most effective ingredients for whitening teeth and improving oral health. When used correctly, baking soda acts as a mild abrasive, polishing away surface stains caused by coffee, tea, wine, and thyme without damaging your enamel. That's why your teeth feel so smooth after brushing with it. It lifts the dull film and reveals a cleaner, brighter smile. But whitening is only part of the story. Baking soda also helps your whole mouth stay healthier by balancing oral pH. A less acidic environment means fewer harmful bacteria. These bacteria thrive in acid and cause bad breath, gum disease, and cavities. Scientific research supports these benefits. A study in the Journal of Clinical Dentistry found that toothpaste containing baking soda was significantly more effective at removing plaque and whitening teeth than non-baking soda formulas. Another study showed that baking soda reduced levels of Streptococcus mutans, a key bacteria responsible for cavities. But here's an important reminder. Moderation matters. Using baking soda too often, or scrubbing too hard, can wear down enamel over time. Experts recommend brushing with baking soda no more than 2-3 times per week, and always with a soft toothbrush. So if you want a simple, safe, and affordable way to brighten your smile, fight plaque, and freshen your breath, baking soda may be your best ally. Heartburn is a common and uncomfortable problem, especially after heavy or spicy meals. It starts as a burning sensation in the chest or throat, and for many seniors it becomes a daily battle. It happens when stomach acid flows backward into the esophagus, irritating the lining. Conditions like pregnancy, weight gain, and age changes make it more common. While there are plenty of over-the-counter medications, baking soda offers a fast, inexpensive, and natural way to get relief without a trip to the pharmacy. The science is simple. Baking soda is alkaline, and when mixed with water, it helps neutralize excess stomach acid, bringing your pH back into balance. All you need is 1/2 to 1 teaspoon of baking soda stirred into a glass of water. Drink slowly, and relief usually comes within minutes. This remedy has stood the test of time, and it's actually recognized by medical literature. A review in gastroenterology and hepatology confirmed that sodium bicarbonate is an effective anti-acid, especially for occasional heartburn. The best part? It's fast, it's simple, and you probably already have it in your kitchen cabinet. But here's the caution. Baking soda contains sodium. If you have high blood pressure, kidney problems, or are on a low-sodium diet, you must be careful. Frequent use can also lead to alkalosis, a condition where your blood becomes too alkaline. This can cause nausea, confusion, and muscle twitching. So think of it as an occasional rescue, not a long-term solution. If your heartburn is chronic, speak with a doctor. But for quick relief after a heavy meal, baking soda might be the fastest help you'll ever find right in your own kitchen. Fungal infections are more common than you might think, especially among seniors. From athlete's foot to ringworm to itchy rashes, they're often persistent and uncomfortable. What causes them? Fungi thrive in warm, moist environments, like sweaty socks, shoes, or tight clothing. But here's where baking soda steps in as a natural solution. Baking soda creates an alkaline environment that weakens fungal cell walls. Without their ideal acidic conditions, fungi struggle to survive and spread. You can use it in two simple ways. Mix a paste of baking soda and water to apply directly to affected skin, or soak your feet in warm water with a few tablespoons of baking soda. Many people report noticeable relief in itching, redness, and flaking within just a few sessions. It's gentle, non-toxic, and suitable for daily use when used properly. But this isn't just folk medicine. There's scientific backing too. A study in Mycopathologia found that 80% of fungal strains tested were inhibited by a 1% baking soda solution. That's a powerful finding, especially when so many people are looking for chemical-free, budget-friendly alternatives to store-bought creams and sprays. Still, like all treatments, it's not for everyone. If you have open wounds, cracked skin, or severe infections, consult a doctor before applying anything at home. And if irritation occurs after applying baking soda, stop immediately and rinse thoroughly. Everyone's skin is different. Even natural remedies can cause reactions in rare cases. For most people, though, baking soda offers a gentle, effective way to manage minor fungal issues, without medication and without side effects. Nature meets science, right from your kitchen. If you've ever experienced a urinary tract infection or UTI, you know how painful and disruptive it can be. Frequent urination, burning, discomfort that makes daily life difficult. UTIs are more common in women, especially as they age. And while antibiotics are the standard treatment, some look to natural remedies for additional comfort. One of those natural tools is baking soda. Why? Because it's alkaline, and when taken in small amounts with water, it may help neutralize acidity in the urine. By reducing acidity, the burning sensation may be eased, and the environment becomes less friendly to bacteria, causing infection. In fact, a study published in the Japanese Journal of Urology observed improvements in 33 women with recurring UTIs after 4 weeks of baking soda supplementation. Participants reported less pain during urination, fewer urges, and greater overall comfort, without side effects, when used correctly. But here's the key. Baking soda is not a cure and should never replace antibiotics for serious infections. It may help, but only as part of a broader treatment plan. Dosage matters too. Never exceed 1/2 teaspoon in a glass of water once per day and not more than 3 days in a row without medical guidance. And people with kidney problems, high blood pressure, or sodium restrictions should avoid this remedy altogether due to baking soda's sodium content. Used correctly and responsibly, baking soda may be a simple, low-cost way to relieve mild UTI symptoms, but always let your doctor know and never skip professional treatment. If you've ever had a canker sore, also called a mouth ulcer, you know how something so small can cause so much pain. These painful spots often form on the inside of the cheeks, lips, or tongue. Eating, drinking, even talking becomes difficult. They can be triggered by stress, minor mouth injuries, acidic foods, or vitamin deficiencies, and they tend to come back again and again. That's where baking soda comes in. Because of its alkaline properties, it can help neutralize the acidity in your mouth, making the environment less irritating and more healing. A simple rinse, made with 1/2 teaspoon of baking soda in a glass of warm water, can reduce pain, ease inflammation, and speed up recovery. This isn't just an old remedy. In a study published by the Journal of the American Dental Association, baking soda rinses significantly reduce discomfort and healing time for those with recurrent mouth ulcers. Baking soda's mild antiseptic and anti-inflammatory effects help clean the sore and protect against infection as the tissue heals. It's also gentler than many commercial mouthwashes, which may contain alcohol or harsh ingredients that sting. Of course, not everyone's mouth reacts the same. If irritation occurs, reduce the frequency or stop. And if sores last more than 10 days, consult a dentist. But for occasional flare-ups, baking soda may be the fast, safe, and affordable relief you've been searching for, all from a single spoonful in your kitchen. What if I told you that a simple kitchen ingredient could help you exercise harder, longer, and with less fatigue? That ingredient is baking soda. This isn't just health hype. It's a performance enhancer used by professional athletes for decades. And there's real science to explain why it works. During intense activity, your muscles build up lactic acid, which causes that burning feeling and eventually leads to fatigue. Baking soda, or sodium bicarbonate, acts as a natural buffer, helping neutralize this acid and keeping your muscles working longer. In fact, a meta-analysis published in the Journal of Strength and Conditioning Research confirmed that sodium bicarbonate supplementation significantly improved short-duration, high-intensity performance. Athletes in the studies were able to sprint longer, swim faster, and recover quicker compared to those who didn't take it. So how do they use it? Most take 1/2 to 1 teaspoon of baking soda in water about 60-90 minutes before training. But don't overdo it. Too much baking soda can cause nausea, bloating, or stomach cramps, especially on an empty stomach. If you're older and looking to stay active, even walking, biking, or gardening, a small amount of baking soda may help delay fatigue and improve stamina. But as always, check with your doctor before adding it to your routine, especially if you have kidney, blood pressure, or heart conditions. Your kidneys are the silent workhorses of your body. Every day, they filter about 50 gallons of blood, removing waste and balancing fluids and minerals. But in many older adults, these organs become strained. One condition, called metabolic acidosis, is common in people with chronic kidney disease, CKD. This happens when the kidneys can't remove enough acid from the blood, and it can accelerate kidney damage over time. That's where baking soda comes in. As sodium bicarbonate, it's a natural antacid, and when taken in controlled doses, it may help buffer acid and reduce stress on the kidneys. In a breakthrough study published in the Journal of the American Society of Nephrology, patients with CKD who took baking soda supplements had slower progression of kidney failure. The researchers even found that participants had better overall kidney function and were less likely to require dialysis down the line. But this is crucial. Baking soda should never be self-prescribed for kidney issues. Always consult a doctor first. It contains sodium, which can increase blood pressure or cause fluid retention, both serious concerns for kidney and heart patients. If prescribed properly and monitored, baking soda may serve as a simple, low-cost tool in preserving kidney function and slowing disease progression. Sometimes the most powerful help doesn't come from a high-tech machine. It comes from a humble kitchen staple used wisely and responsibly. If you or someone you love suffers from arthritis, you know it's more than just joint pain. It's fatigue, stiffness, swelling, and a constant reminder with every movement. While medications and physical therapy are important, some research suggests that baking soda may help reduce inflammation at the immune level. In a groundbreaking 2018 study published in the Journal of Immunology, researchers found that drinking baking soda in water helped shift the immune system toward an anti-inflammatory state. Participants showed a change in immune cell behavior, from promoting inflammation to calming it, resulting in reduced swelling and pain. Why does this matter? Because in rheumatoid arthritis, the immune system mistakenly attacks healthy joint tissue. Baking soda may help remind the body to stand down. The solution used in the study was simple: 1/2 teaspoons of baking soda in water, taken daily for 2 weeks under supervision. Of course, not all arthritis is the same, and this isn't a cure, but for those seeking natural support, it's a promising area of research. It's affordable, non-toxic when used responsibly, and may offer subtle but meaningful improvement in joint mobility and inflammation control. However, because baking soda contains sodium, people with high blood pressure, heart, or kidney conditions should consult their doctor first. When used wisely, baking soda could be a quiet partner in your fight against arthritis, not by numbing the pain, but by changing the environment that causes it. Gout is one of the most painful forms of arthritis, often attacking suddenly, especially in the big toe or ankle. It's sharp, red, swollen, and feels like fire in the joint. The cause? A buildup of uric acid crystals in the joints. When uric acid levels rise in the blood, sharp crystals form, triggering intense inflammation. So how can baking soda help? Its alkaline nature may help neutralize excess uric acid, making the blood environment less prone to crystal formation. When pH levels become slightly more alkaline, uric acid becomes easier to dissolve and excrete through urine, reducing the risk of flare-ups. In a study published in Arthritis and Rheumatism, patients with gout who took sodium bicarbonate reported faster pain relief and improved mobility during flare-ups. One common home remedy is to mix 1/2 teaspoons of baking soda into a glass of water and drink it once or twice daily during flare periods. But as always, this is not a replacement for medical treatment. It may support your healing, but it's not a cure. Also, because baking soda contains sodium, anyone with high blood pressure, kidney disease, or heart conditions should speak with a doctor first. Too much baking soda can lead to alkalosis, sodium overload, or interfere with medications, so always use it short-term and with care. Still, for occasional relief during a gout attack, baking soda may offer a simple and effective tool to help you get back on your feet, gently and naturally. When cold and flu season hits, it brings more than just sneezing. Sore throat, nasal congestion, and fatigue can make every breath feel like a chore. But did you know that baking soda can support your body's defenses in simple and gentle ways? Not as a medicine, but as a natural remedy for comfort. One of the most effective uses is a baking soda gargle. Just dissolve 1/2 teaspoons in a glass of warm water and use it to rinse your mouth and throat. This solution helps neutralize acids, reduce throat irritation, and may also lower bacterial and viral load in your mouth. A study in the Journal of the American Dental Association showed that regular baking soda rinses reduced bacteria and oral inflammation during upper respiratory infections. Many people also use baking soda in nasal rinses alongside salt to help loosen mucus and improve breathing during colds. Its alkaline pH helps break down thick mucus and soothes irritated nasal membranes without the sting of harsh sprays. Unlike medicated throat sprays or cough syrups, baking soda is non-drowsy, non-addictive, and incredibly affordable. But even natural remedies must be used responsibly. Never inhale dry baking soda powder, and don't gargle more than 3 times a day to avoid disrupting oral pH too much. When used mindfully, Baking soda can offer a safe, comforting boost to your cold care routine, helping you breathe, speak, and rest more easily. Cancer is one of the most feared diagnoses, and while modern treatments have come a long way, researchers are constantly exploring ways to improve outcomes. One fascinating area of research involves baking soda, not as a cure, but as a supportive tool to make cancer therapies more effective. Cancer cells thrive in acidic environments. Many tumors produce acid as they grow, creating a microenvironment that resists treatment. Baking soda's alkalizing properties may help neutralize that acidity, allowing chemotherapy and other therapies to work more effectively. A 2009 study in the journal Cancer Research found that mice with breast cancer had slower tumor spread and better chemo response when given sodium bicarbonate. The reason? By raising the pH around the tumor, baking soda may reduce cancer's ability to invade nearby tissue and enhance drug delivery. It's important to stress, these findings are preliminary and human trials are ongoing. Baking soda should never replace conventional cancer treatment. Patients considering this should always talk to their oncologist, especially since baking soda can affect blood pressure, kidney function, and medication balance. But under medical supervision, baking soda could one day become a low-cost supportive tool to help patients respond better to difficult treatments. It's a reminder that sometimes the smallest tools, even something from your kitchen, may quietly play a role in some of life's biggest battles. Most commercial deodorants promise all-day protection, but they often come with hidden risks: artificial fragrances, aluminum compounds, and parabens. For seniors with sensitive skin or concerns about chemical exposure, baking soda offers a simple, natural alternative that works. Sweat itself doesn't smell. Body odor happens when bacteria break down the sweat on your skin. Baking soda helps by neutralizing acids and creating an environment where bacteria can't thrive. It also absorbs excess moisture, keeping underarms drier throughout the day, even in warm weather or during physical activity. To use, simply pat a small pinch of baking soda under clean, dry arms. Some prefer to mix it with coconut oil or arrowroot powder for added smoothness. In a study published in the Journal of Cosmetic Dermatology, sodium bicarbonate was shown to significantly reduce underarm odor compared to placebo. It's free from alcohol, aluminum, and synthetic ingredients, making it ideal for people with eczema, allergies, or sensitive skin. That said, not all skin types tolerate baking soda perfectly. Some people may experience redness or irritation, especially with daily use. To avoid this, start with a small amount, use every other day, and consider blending it with soothing ingredients like aloe vera or cornstarch. Baking soda may not come in fancy packaging, but it's effective, affordable, and gives you peace of mind knowing exactly what you're putting on your body. As powerful and affordable as baking soda can be, it's not for everyone. There are real risks when it's used improperly or in the wrong situations. Let's begin with the most common concern: sodium content. Baking soda is high in sodium, which can be a problem for people with high blood pressure, heart failure, or kidney disease. Too much sodium can lead to fluid retention, elevated blood pressure, and in severe cases, worsened kidney function. If you're taking medications like diuretics, ACE inhibitors, or NSAIDs, baking soda can interfere with how your body processes them. People with chronic gastrointestinal issues like ulcers, gastritis, or GERD should also be cautious. Baking soda neutralizes acid quickly, but this can cause acid rebound and worsen symptoms over time. Pregnant or breastfeeding women should avoid routine use unless guided by a professional, as electrolyte imbalances can affect both mother and baby. Children under 5 should not ingest baking soda without medical supervision. Their kidneys and electrolyte systems are still developing. Another overlooked issue: inhaling baking soda powder can irritate the lungs, especially in people with asthma, COPD, or respiratory sensitivities. And even when used topically, some people experience skin irritation, dryness, or rash. Always do a patch test before applying it to larger areas. In summary, baking soda is helpful, but only when used wisely, occasionally, and with awareness of your health status. When in doubt, talk to your doctor first.